45-year-old patient arrives at the emergency room with left iliac fossa pain. They undergo an ECG before having an appendectomy, meaning they arrived with left iliac fossa pain, were diagnosed with appendicitis, and had an electrocardiogram performed before surgery, which we will see shortly. It's worth noting that this patient had a previous electrocardiogram from a few years ago, which was identical to the one we will show next, meaning there were no changes in the ECG during that period. The patient's electrocardiogram did not reveal any functional or structural heart disease. Now we repeat the ECG as a preoperative assessment for the appendectomy surgery, and we want to know the diagnosis based on the electrocardiogram. So, what can we observe in this electrocardiogram? If we take a look, we can begin to notice that it does not seem to be a sinus rhythm at first glance. We have a negative P wave in D1, right? So there's an atrial rhythm with a negative P wave in D1 and a seemingly normal PR interval. However, when we examine the QRS complexes in the limb leads, we can already see a completely deviated axis. We have a negative D1 with a positive VF, meaning that the axis is deviated to the right. When we move to the precordial leads, the R wave progression that I mentioned earlier, which usually starts with a small R wave in V1 and grows until V6, is not happening here. On the contrary, it's a moderately sized R wave that is decreasing as we move towards V6, just as the amplitude of the QRS complexes is also reducing. So what I'd like to draw your attention to is the negative QRS complex in D1, negative in AVL, positive in AVR, and positive in AVF. If I look at this, I might think, gosh, could there have been a cable swap? But when I examine the precordial leads, I see that the R wave from V1 to V6 is also decreasing instead of progressing. We then associate this with the clinical picture. The patient has a diagnosis of appendicitis with pain in the left iliac fossa. Generally, patients with appendicitis have pain in the right iliac fossa, which is typically where the appendix is located, right? So here we have the tracing of a patient with Situs Inversus Totalis, meaning this is a classic dextrocardia ECG. A tip for you is that to be sure this is not a swapped electrode, you can also look at the precordial leads. That is, you looked at D1, saw that the P wave is negative, the QRS complexes are negative, so maybe the arm electrodes were inverted. But then you look at the leads from V1 to V6, and you can see that the R wave, instead of progressing as it should, is regressing. So why? Because from V1 to V6, instead of getting closer, we are moving away from the heart and not getting closer because this patient's heart is on the right, not on the left where the classic positions of V1 to V6 are. Thank you for taking the time to learn with us today. Please share this video with your colleagues, subscribe to our channel, and give us a positive evaluation. We hope to see you soon in our next video.